Cases are on the decline, but they're still unsure if the worst is behind us. New government data posted Friday shows declines in medical office visits due to flu-like illness in a number of states reporting high flu activity. However, some experts say the severity of this year's flu season has surpassed last year. The Centers for Disease Control and Prevention estimate there have been at least 15 million flu illnesses and 180,000 hospitalizations with 7,400 deaths. Here in Utah, flu-related hospitalizations have hit peak levels with more than 8 hospitalizations per 100,000 people. The flu vaccine still provides strong protection against hospitalization and death, even with this year's strain mismatch.
What's important to realize is that H1N1, which is an influenza A, and influenza B are also circulating. Those are very well matched by the vaccine. So the bottom line is that the vaccine is still really important, and people who have not been vaccinated are running out of time to protect themselves if they haven't already gotten sick with influenza.
Primary Children's Hospital says they're very busy, but haven't exceeded capacity yet. On Monday, federal health officials released new childhood vaccine guidelines, rolling back recommendations on some vaccines, including for the flu. However, some doctors and experts say the new guidelines are causing confusion and worry, with some pediatricians saying this is a step in the wrong direction. Fox's Juliet Vera has more.
Many medical experts are calling it an unprecedented move. The Centers for Disease Control and Prevention pulling back on a number of recommended vaccines for children, sidelining 6 of the routine immunizations that have been used to protect children from diseases for decades.
I don't think we should pull back. We've been there, done that.
Dr. John Bradley is a pediatric infectious diseases specialist with Rady Children's Hospital with 37 years of experience. This, he says, is a decision that will put children at risk.
We're going backwards. Diseases that can be prevented with vaccines that we have, if we stop giving them, those diseases will come back.
The new CDC guidelines no longer universally recommends vaccines for rotavirus, COVID-19, influenza, hepatitis A and B, and meningococcal disease, although some will remain recommended only for high-risk groups.
Meningococcus causes meningitis and a bacterial bloodstream infection that is so profoundly serious, 50% of the kids die.
As for rotavirus, Dr. Bradley says it's an illness that can lead to complications, even death in other countries, and it too is preventable with a vaccine.
The hospital is filled with kids with rotavirus diarrhea every winter. These kids pick it up, it's highly contagious, and then they just start vomiting and have diarrhea, and there's nothing you can do about it.
The CDC citing that its new guidelines allow for more flexibility and choice and less coercion. In essence, giving parents and pediatricians more control of health decisions. A dangerous move, if you ask Dr. Bradley. He says given the new circumstances, the hospital has plans to ramp up in order to care for as many children as possible if needed.
There will be people who will listen to what's coming out of the CDC and go, oh, well, I don't need a vaccine. My kid doesn't need a shot. Well, I'm not going to have that. And they don't know until they get sick that it's preventable.
There are 11 vaccines recommended by the CDC that will continue to be covered by insurance. They include vaccines for measles, chickenpox, and polio. From Rady Children's Hospital, I'm Juliet Vara.
Wednesday's deadly shooting in Minneapolis